HHA Practice Test 2026 Home Health Aide, Full Course Standard Precautions and PPE. Question 1. When should an HHA use standard precautions? Only when a client is known to have an infection. Only when blood is visible. For every client, regardless of their diagnosis. Only when ordered by a doctor. Standard precautions are used for all patients to prevent the spread of unrecognized infections. Question 2. What is the single most important way to prevent the spread of infection? Wearing gloves at all times. Hand hygiene. Using a mask. Keeping the room temperature high. Hand hygiene is the most effective way to prevent the transmission of pathogens. Question 3. Which of the following is considered PPE? Stethoscope, gloves, gowns, and masks. Bed linens. Hand sanitizer. Personal protective equipment, PPE, includes items like gloves, gowns, masks, and eye protection. Question 4. When doffing, removing, PPE, which item is typically removed first? Gown, mask, gloves, goggles. Gloves are usually removed first because they are the most contaminated part of the PPE. Question 5. Standard precautions apply to which of the following? Blood and body fluids. Non-intact skin. Mucous membranes. All of the above. Standard precautions apply to blood, all body fluids, non-intact skin, and mucous membranes. Question 6. What should an HHA do if their gloves become torn during a procedure? Continue until the task is finished. Tape the tear and continue. Remove the gloves, wash hands, and put on new gloves. Wait for a supervisor to check. If gloves are damaged, they must be replaced immediately after hand hygiene. Question 7. How should used needles be disposed of? In the regular trash. In a puncture-resistant sharps container. Wrapped in a paper towel first. Recycled. Sharps must always go into a designated sharps container to prevent needle stick injuries. Question 8. When should a mask be worn? When there is a risk of splashing blood or body fluids. During every client interaction. Only when the client is coughing. Only in the kitchen. Masks protect the mucous membranes of the nose and mouth during procedures likely to generate splashes. Question 9. In what order should PPE be put on, donned? Gloves, mask, gown. Gown, mask, gloves. Mask, gloves, gown. Gloves, gown, mask. The standard order is gown, then mask/respirator, then goggles/face shield, then gloves. Question 10. What should an HHA do with a soiled gown? Shake it to remove debris. Roll it inward, away from the body. Leave it on the floor. Take it home to wash. Soiled linen and PPE should be handled as little as possible and rolled away from the body. Question 11. Which organization sets the standards for bloodborne pathogens in the workplace? FDA, OSHA, CDC. Who? The Occupational Safety and Health Administration, OSHA, sets and enforces safety standards. Question 12. What is a nosocomial infection? An infection caught in a community setting. A healthcare-associated infection. A viral infection. An infection that only affects the skin. Nosocomial infections are those acquired during a stay in a healthcare facility. Question 13. When should an HHA wash hands with soap and water instead of using alcohol rub? When hands are visibly soiled. After touching a client's arm. Before putting on gloves. Every 2 hours. Soap and water must be used if hands are visibly dirty or contaminated with proteinaceous material. Question 14. How long should an HHA lather their hands during hand washing? 5 seconds. At least 20 seconds. 1 minute. 2 minutes. Effective hand washing requires at least 20 seconds of vigorous scrubbing. Question 15. What is the purpose of a gown in PPE? To keep the HHA warm. To protect the HHA's skin and clothing from contamination. To make the HHA look professional. To prevent the client from getting cold. Gowns are designed to prevent contamination of skin and clothing. Question 16. Where should PPE be removed? In the kitchen. At the doorway or in the anteroom. In the HHA's car. In the hallway. PPE should be removed at the doorway or in a designated area to prevent spreading contaminants. Question 17. If a client has a cough and fever, what additional precautions might be needed? Airborne or droplet precautions? Only gloves? Only a gown? Specific symptoms may require transmission-based precautions in addition to standard ones. Question 18. What is the clean to dirty principle in infection control? Wash the dirtiest areas first. Work from the cleanest area to the most contaminated area. Only clean what you can see. Clean the floor before the bed. Working clean to dirty prevents the spread of pathogens to unaffected areas. Question 19. Are gloves a substitute for hand hygiene? Yes. No. Only if they are sterile. Only if worn for less than 5 minutes. Hand hygiene must be performed after removing gloves because they may have microscopic tears. Question 20. What should an HHA do if they are exposed to a client's blood? Ignore it if there's no cut. Wash the area and report it to the supervisor immediately. Wait until the end of the shift to report. Ask the client if they have any diseases. Immediate washing and reporting are critical for post-exposure protocols.